Nothing in this podcast is intended to render legal, financial, medical, or other professional information. Because the details of your situation are fact dependent, we highly encourage you to find a recommended individual that you can trust to give you the expertise that you need related to your situation. And you're listening to Concierge Medicine Today's DocPreneur Leadership Podcast. One of my favorite physicians that I just love to talk to. In fact, we could just talk for hours and hours. There's no shortage of topics that you and I can riff on, and certainly, I bet you're a good one for a dinner conversation. Like around the dinner table, you're like, I can always talk about something. Dr. Chad Levitt, he is a concierge medicine radiation oncologist at ONCare or ONC dot ONCMD.org. We'll put the links to the show notes below, but he's a board certified radiation oncologist, an Atlanta native, and well, he's better at telling his own story than I am. Thanks for being our guest today.
Yeah, I really appreciate it. Looking forward to this. Thanks so much.
So before we jump in, we ask this of all of our physician guests. What was your story of moving into healthcare, becoming a physician? Why did you choose that specialty? For some folks, it's family business. For others, it was a personal story that, hey, I'm going to do this in this area because, I don't want that to happen to any other person again. Or maybe you were done wrong or you were done right and you had some good mentors and leaders. What's your story?
So thanks for asking. Radiation oncology is a pretty small specialty that at the time I was training, even in medical school, you didn't really ever hear about or know about. I came to medicine from a medical family. My father was a pediatric dentist for many, many years, and I studied in undergraduate liberal arts, completely existential philosophy and creative writing, and got a graduate degree in those. But always knew and had an interest in going into medicine and go to medical school. I went to medical school specifically to uh, do craniofacial reconstruction. That's what I think that my dad being a dentist, I love this anatomy, and I was hard set on that. Did a lot of research, et cetera, before medical school, and published some papers in that, especially. As medical school went through, I think there's a couple different types of medical students. The one type is everything's so interesting and so challenging and compelling that they just can't figure out what specialty they want to go into because everything's just got its own unique passion driving forces. Um, I was on the other side where there were a lot of specialties that we rotate through and learn about, and I was like, I am not wired to do that. My dad is a pediatric dentist, could just walk into a room of crying kids and they all just calm down. His presence alone and his tone and spirit just calm them. Pediatrics was not for me. There were a lot of other ones that I think my philosophy background led me to not necessarily pursue things like the sniffles and earaches and sore throats and compliance for chronic diseases like hypertension and diabetes discussions with patients. And I really was looking for something where I could have a significant effect in patients' lives in a way that was dramatic. And so I was at the large indigent hospital here in Atlanta, Grady Hospital, and I was doing surgery with the plastic and reconstructive surgeons who were doing what I thought I wanted to do. And one of them said, if I could do it all over again, I'd go be a radiation oncologist. And at the time, I was in this mindset of I'm a surgeon, I'm going to go do what I plan to do, and okay, whatever. And about 2 weeks later, another person who was in the later part of their career doing what I was planning on doing said the same exact thing. And I figured I need to look into this, it's at least to say that I've done my diligence. And almost immediately the oncology patients, the cancer patients, and I really connected. I felt very fulfilled. I felt like this was a cancer being a diagnosis that we don't have cures for all cancers. It was going to be an ongoing intellectual and behavioral challenge throughout my career. It involved tons of technology as well as biology and clinical medicine. So it was sort of a perfect intersection of the things that were driving me. You know, having a strong interest in technology and software and advancements in the fields of medicine, being able to connect with patients on the larger interpersonal challenge of dealing with the cancer diagnosis, and incorporating a lot of biology and clinical medicine as well. That led me to radiation oncology, which I trained at Emory for, and dating myself a little bit, finished in training in the early 2000s, and then proceeded with a couple of decades of practice in multiple environments, running different departments, running a private practice, starting my own group, working within hospitals, working outside of hospitals, and doing lots of research and seeing many thousands of patients over the course of the last 22 years. Most recently, as the landscape of practicing oncology of all aspects has changed, I felt there was a huge need in filling in a lot of aspects of care and treatment for patients that have fallen a little bit by the wayside as care has become more institutionalized and fragmented for many patients, having one surgeon, one oncologist, one radiation doctor, one endocrinologist, one primary care doctor, and perhaps even being seen at different facilities and different institutions, and being on different trials and research protocols. So about 1 year ago, we launched ONCare specialty consultants, specifically to help patients and their family members navigate every aspect of the cancer journey, be it at the time of diagnosis or the time of recurrence, or during some information overload aspects of multiple opinions. And really just felt the need was so strong that we wanted to offer this directly to patients as opposed to just working within one system or another. And this allows us to be completely unincentivized by anyone other than the patient and the patient's greater good, and arguably one of the only team members on their care team that would be able to say that, since oftentimes the insurance creates boundaries, or your employer creates boundaries, or the landscape of resources that you have to offer a patient doesn't offer a comprehensive set of options. So we've grown a lot in the last year, and have continued to strategize for offering patients and families a different experience than what they might otherwise be left with.
Well, our guest today is Dr. Levitt. He's a radiation oncologist here in the concierge medicine space, which, you know, sometimes I'll appropriately title, you know, you're a unicorn. You know, like how you stumbled into this space in your specialty. It is fascinating. So thank you for the work that you're doing, because I want to line up my line of questioning for the listeners, but also for you. We're going to pull back and look at what a traditional, you know, cancer diagnosis looks like. Not specifics, but what that process looks like, and why is it broken. And, you know, we can talk a lot about, well, healthcare is broken and there's a million different ways that we can solve it. Yes, that's not the conversation we'll solve today. But we just want to talk about that narrow process. And, you know, I'm reminded of something I saw on television the other day. It was, you know, hey, we don't kill sheep, we kill wolves. And, you know, if patients are the sheep, they're being thrown to the wolves, so to speak. And we are alone. I'm not a physician, but I'm a patient. And so I do know what it's like to sit on the other side of the exam room the sliding glass window from so many physicians as a family, for with my kids, my sandwich generation parents. So I want to walk through that process of a current cancer diagnosis. What does that look like for the patients, and what problem are you trying to solve?
That's a great starting point. And let me clarify that while my traditional training and practice was in radiation oncology, I was very involved in all aspects of the cancer diagnosis, treatment, and journey. And so our current model addresses not only radiation, but questions about surgery, questions about supplemental treatments, adjuvant chemotherapies and drug treatments and targeted therapies and immune therapy and everything that's happening, as well as trying to navigate all the insurance aspects and scheduling logistics. So there's a lot that goes into what I recently heard termed as whole person care or whole patient care, as opposed to just tumor directed care or diagnosis directed care.
Hmm.
Um, so to answer your question, a typical cancer diagnosis for a patient, as well as for their treating team, really merits what I've coined into three separate stages uh, of planning and diagnosis. So the first of which, uh, uh, again, from a very general point of view, would be let's make sure we know exactly what we're dealing with. Has the diagnosis been properly worked up? Have all the needed tests been done? Have we've done different emerging technologic studies on the different kinds of mutations and genetics that went into this cancer? Because once you start treating a cancer, you may have burned some of those information bridges or baseline information that you might want to compare things to down the road after treatment or during treatment. Is the treatment working, et cetera? So the very first thing is to make sure all the I's are dotted, all the T's are crossed, and we're not just rushing to treat something before we know as much as we're able to today what exactly we're dealing with, both anatomically as well as biologically. So that takes a tremendous amount of time and effort and coordination. And sometimes it's, one aspect is done really well, and another aspect might not be, or we may not be as collegial doctors familiar with what the medical oncologist, the chemotherapy doctor might need that would be important to them to help direct care, or the surgeon, for instance. So while a lot of places have multi-specialty or multidisciplinary approaches, the point of entry from a patient often is from their primary care doctor or a specialist who they were sent to because of a symptom that wasn't getting better, and ultimately led to typically a biopsy and lots of different kinds of scans, PET scans, MRIs, CAT scans, ultrasounds, things like that. So you need to help bring the glue together for these teams to make sure that all of the diagnostic information has been done in a timely manner, as well as in a comprehensive manner. That would be stage one, or not cancer stage one, but step one of a cancer diagnosis and journey. Step two, in my experience and opinion, is arguably the most important, and that is helping patients understand the full breadth of options to treat this that are within standard of care. And standard of care just means everything within this standard is appropriate and recommended. It doesn't mean the guidelines tell you the exact right answer for each individual. I think it's up to us as humans and as colleagues with our patients to figure out what it is that's important to them in their lives as it relates to this cancer diagnosis, and then discuss with them all of the options, whether they're offered specifically at one system or one hospital or another, and then even more importantly, discuss the pros and cons of each aspect or option of treatment. And in order to do that in a really high quality manner, you have to understand a bit more about your patient and what's important to them. Is the thing that might be important to a 85-year-old, otherwise healthy patient may not be the same thing that's important to a 35-year-old who might be more interested in how they look in their bikini than they are in just, directly managing something to minimize suffering. So anyways, a lot of people would say that that falls within what's called the informed consent step, which if anyone's ever been a patient of any sort, they often have signed an informed consent sheet. And in the modern practice of medicine, while the doctors do need to go over the pros and cons of different treatment options or the recommended treatment option, and then have actually a signature from the patient saying that they understand that before proceeding with allowing a treatment team to do something to a patient, is really critical, but it's often condensed into a very quick step. Like even sometimes the day that you show up for your surgery, they say, oh, by the way, we need you to sign this informed consent. Your doctor went over with you all the risks about what we're about to do to you, right? But if you don't sign this, we can't even take you to the operating room or take you to do the MRI. And so that to do in a really comprehensive and high quality manner, that takes a lot of time. And we don't get real formal training in how to be present and mindful with our patients. So you either learn that or bring that to the table as a doctor of any sort, or you find that to be a need and pursue it independently on how to develop that skill to communicate, to understand, to listen, and to be present. Thirdly, so that would be the second step, this comprehensive review of all the treatment options based upon a very good diagnostic workup. Thirdly, and while what training would spend the most time on for doctors is to develop your skill set at delivering treatments safely and effectively and in a modern, high quality manner. So that's what a lot of us doctors go to medical school and residency and fellowship to become experts in. How do I treat this? How do I remove this? How do I make sure that the patient survives this and I effectively treat them? That, once you've practiced for a little bit, arguably is one of the easiest things. And while it's the third step, and what you're ultimately focusing on is how do I get rid of this cancer? How do I cure myself or get cured? Or how do I treat this in a way that this is not going to continually bother me or threaten my life or shorten my life or cause suffering? And that is where in many cancers, some are fast growing, but the majority have developed in a predictable manner. You as an individual patient can shop around and find who is the person who does the procedure that I think is best fit for me out of the right standards that are recommended, that does this 3 times a day, every day of the week, Monday through Friday, and doesn't just add this on as maybe something I do in addition to a lot of other things. And so you can select and find your treating team in a intentional manner, as opposed to often feeling rushed. So the treatment is very important, but as far as the amount of time that goes into planning and discussing and communicating and educating a patient, that arguably is the least time consuming. And there's lots of doctors who are excellent at delivering treatment.
Well, our guest today is Dr. Chad Levitt, and we'll link to his website and how to connect with him and his practice in the show notes below. But as you've been talking, I've been writing down some questions that I think, really focus and narrow this niche. And this is so unique and so needed. And to continue in the space of kind of before we go into the exam room, into your practice, what bothers you about the way things are right now?
That's a great question. That's changed as I've aged and built a family and focused in a more mature manner on how to best develop best use of my time and energy and efforts and resources and interests. I don't think that it's realistic anymore for a patient or a doctor or a system or any of us in society to expect that the traditional treating physicians, the traditional oncologists, surgeons, radiation oncologists, can comprehensively and adequately provide or do all of the things that I just laid out, as far as a great workup, a great discussion with the patient that's comprehensive about the pros and cons and what's important to the patient, and also be at their A game all the time for delivering the best and safest and most effective treatments. So what's bothersome is that it's not that anyone involved with patient care or treating patients themselves are negligent or dispassionate or uninterested or unempathetic. It feels sometimes like that's the case, but the reality is the landscape that we work in does not as physicians does not necessarily make it easy for you to carve out enough time and energy and generate enough reimbursement for your employer, for your hospital system to deliver the care that is provided in hospital and clinic settings. And in fact, really the core of what's most bothersome is that if a doctor feels or communicates too passionately about these gaps in care, and that there's a dilemma with our Hippocratic oath, as well as with wanting to care for in an empathetic way for our individual patients, there are forces, both political, economic, as well as collegially, that would deter a physician from being what could be viewed as alarmist or disruptive, which is a very specific term, and I would seek to find something even softer. But if you don't gel with these institutionalized teams, or you're doing something that is not within their set of resources, you can find your day-to-day experience of practicing medicine much more challenging and emotionally stressful than it otherwise would be. So it's definitely one of these situations where it's not the individual players, it's the game of healthcare. It's the landscape that has got some major dilemmas that are not easily solved. So that led me and my team to really want to directly address what we can do for patients on a smaller scale, while we know that on a larger scale, in parallel to the kind of work that we're doing, there are other entities and interests working to change the landscape, but that is a much longer and arduous process and endeavor than what I felt most fulfilled doing, which is spending time with patients and helping them as much as I'm capable of throughout their entire journey, so that they end up receiving the kind of care that I would like to receive myself, or I hope that my children and friends and loved ones can ultimately expect and hope for as we evolve in today's world.
Well, our guest today is Dr. Chad Levitt. He's a radiation oncologist, and his website is in the show notes below, as well as his contact information. But he's working here in the Atlanta area as a concierge medicine radiation oncologist. But in a bigger picture, you're more than that to your patients. You're more than that to the physicians that you're working with, your peers. So we're going to log in, so to speak. This is the part of the question, the next question of the podcast. It's not even really a question. It's really solving all the world's problems of healthcare. That's what we do. And that's the conversation we'll have. So you've opened the door. We walk into your practice, or we log in. What's a typical day look like for you? Now, with that being the primary question, a little bit of background on that is the role of telehealth, virtual visits has radically changed in the last few months or years. I'm sorry. Um, and the cancer care journey has probably changed a little bit as well, where, well, I really want you to come in, but you may say, yeah, I've seen it. Like you don't need to inconvenience the patient by making them take a half a day off of work and then all that stress of getting down there and then you're late again. And, they are not going to be able to interpret or understand what the doctor or the practice is saying. So what does a typical day look like for you, and how do you interact in person, but also how do you interact with the new devices out there?
So when I set out to develop this practice and hang the shingle, so to speak, I was I was trying to up the level of care for the patients that I was going to come into contact with. I offered and continue uh, to meet or have someone from our team meet in person for actual like old school house calls, with this idea that, oh, we can sit down with you and your loved ones, we can have no specific time constraints, and we can, in the comfort of your own home, develop a strategic plan and to review your case and images, and then discuss in a less stressful and less time constrained manner the options and things. Um, I was a bit surprised in that not many patients wanted to take the time to set those meetings up, even though we could be quite efficient and urgent in meeting. Most people, because of COVID and the adoption of telemedicine and virtual meetings, most patients preferred to meet by video or by phone or communicate by text or emails. We have a wide range of availabilities to address things specifically. My client base and patient base is not regional. I thought initially that was going to be something that we would start out with. Almost immediately, we have patients in many states around the country: California, New York, Florida, Texas, Georgia, to name a few. And we're licensed in all of those states to practice medicine. And so that is something that was a first step, making sure that legally we were covered within the scope of what we do. That was a bit of a challenge because you're right. There are not many, if any, doctors out there delving into this space of exclusive practice towards navigation, advocacy, and education. The traditional model is you get paid to treat patients, you get paid to do things to patients. And when you work for a hospital or a practice, or you are dependent only on insurance or Medicare or Medicaid, um, there are very specific requirements that you have to meet to stay in business, to get reimbursed. Once we untethered philosophically from those means, it really does allow us to meet patients where they are in today's landscape with no bias, no conscious bias or obvious incentive other than working with that patient and their family to achieve, something that's meaningful and effective, but is within the scope of their preferences. Because medicine is not cookie cutter. The current landscapes would like to objectively evaluate each patient in a very similar manner to come up with how to best run the business and the reimbursement models, and you look to traditional as well as modern evidence or studies and publications. But things are moving so fast with the advents of the biologic inventions and discoveries when it comes to cancer, the genetic dependency of different cancers, and the treatment options that are just coming out at lightning speed today. And so we don't always have 20 years of research on the latest and greatest options. And sometimes you need to think outside the traditional box or the guideline-based box to come up with the best option for those patients. And all of these questions lead to anxieties and stressors and insomnia and things that we know affect your wellness and your healing and your health besides just tumor-based treatments. And so we really seek to shoulder the burden of a lot of the logistic and quality and information stresses that happen to patients and their families as they engage in this unfortunate but new journey. It's a different language. Patients are scared. They don't know how to prioritize the different treatments or the different opinions or the different information they're getting. So my day is very varied in the sense that sometimes I'm engaging with new clients, discussing some aspect about their diagnosis, sometimes we're talking with them before or after their doctor's visits or before or after another set of scans or lab values. So a lot of what we do is helping them speak the right language, prioritize their stressors and their anxieties and their questions, and making the most efficient use of their time with their treating doctors. So ultimately, we're like a liaison for patients and their treatment team to make the best use of the time they do have in the clinic with the doctor who is treating them or ordering their labs or giving them drugs. And as a result of that, a lot of doctors, while we're quite novel and in their initial reactions might be, wait a minute, I'm your oncologist. Why do you have another group of oncologists helping you? When they realize that our patients and our clients come in more educated, more comfortable, more focused on how to make the most effective use of the treating doctor's time, they ultimately realize and appreciate and herald how much of a help this is. So sometimes, like basically our clients, if they have a doctor's appointment coming up, we reach out to them if we haven't heard already, a couple days beforehand, say, what are your questions? Here's what's going on. We review and manage all your medical records and images so that if they aren't planning on asking something, or if they are, we help them formulate those questions to be as efficiently and effectively answered as possible. We do offer being available or present actually during the doctor's visits, just like a loved one or family member might be, either through virtual settings or while we've offered on occasion to be in person. That's a little bit more of a logistic challenge with the scope of our team at this point. But yeah, we do a lot, and then we review scans, and then afterwards, after a doctor's appointment, we debrief. Or oftentimes, if a patient gets the lab results or the scan results through my chart or a type of application that the hospital they're being treated at might use, they may have a report they're reading that they don't understand that sounds scary, and sometimes it is, sometimes it's not. And we address that in real time, after hours, over the weekends. We're like your family member that's an oncologist that's available to you as much as you might want. Some people more than others, some people less. To really hold your hand and make sure that the journey goes well. We try to divide things up into, let's come up with a strategic plan. Let's have contingency plans B and C. And then really the biggest challenge is making sure the execution of the treatment plan as intended or recommended is coordinated and goes as well as possible. And sometimes we participate with their treating doctors to brainstorm on some additional options or aspects they may not be as familiar with. Other times we just help the patients be as prepared as possible to take advantage of often the limited amount of time the treating doctor has available to discuss any aspect of their care with them.
How often do you have to, and it sounds like you don't have to get involved peer to peer very often. So but and the patients are coming into those visits with their different physicians, very prepared, more informed. However, there are going to be questions that they have in the middle of that, and they'll forget to ask them. And then the debrief is going to be so important. So thank you for doing that on behalf of being a patient. I think that is so helpful. But how often do you have to talk with your peers? And is there, I mean, everybody talks a big game at medical conferences, right? Like, oh yeah, we all like each other. We're all super respectful of each other. But at the same time, you get out there on Tuesday afternoon and you're challenged with a busy schedule, and, you've got a patient that, wasn't necessarily given all the facts, wasn't given everything that they needed, and quick decisions were made. And it's not the fault of any particular person. Again, that's not the podcast we're talking about today of how to solve a broken system. But, is there a natural respect of between what you provide as kind of this advisor to the patient, and how often do you have to get involved in those peer-to-peer conversations? Or is it really kind of, I just deal with my client who is the patient, who's my customer, and every now and then, super rare, I have to talk to one of their docs?
No, in fact, if, if every client of ours is different, every patient is different the way they're wired, and every treating physician is, as are all of us humans. Some of us handle stress and workloads better than others. Some of us are great communicators, but not as efficient as things. So to answer that question, we offer for our clients, the goal, the mission that I came up with was advocacy through education. I'll teach you the language about your disease and about the options out there, and we'll arm you with a bullet point set of questions at each and every visit, that, as well as we discuss with you, things that might be unique to your interests. And our clients walk into each of their doctor's visits with a very refined set of bullet points to cover. And we offer advocacy through that education or on behalf of that patient. If they say, well, I'd really rather it if you could talk to my doctor. We have releases of medical information forms on all of our patients, that to a doctor, is no different than saying, hey, this is another doctor on my team. Would you please share the information with them? Now, when you go into a doctor's visit, you might say to them, would you mind getting on the phone with my spouse or my parent or my sibling or offspring, to explain to them in your own words what it is you've just tried to explain to me, because I, as a patient, am not as confident that I'm going to be able to clearly communicate what you just told me as well as I'd like. Now, as a lot of you may know, some doctors are going to be happy to do that. Sure, give me their cell phone, or give me an email or have them call me. Other doctors, that's just not something that they do or have the time or interest in doing, and it can be overly burdensome. So no different than your family member or another one of your doctors, we offer that. And oftentimes the doctors that recognize the value in that to make their patients' lives easier, to make ultimately their lives easier, because the patients are going to have far less questions if they really understand what it was that you were intending to communicate. So a lot of doctors are happy to get on the phone with us. Once I introduce what we do and how we really do view ourselves as a liaison, not a looking over your shoulder kind of point of view as to, are you doing things correctly, which we do softly. And if there was something alarmist about what was happening or unproven from an evidence-based point of view, we would make sure the patient was aware that there may be some ambiguity there. But a lot of the doctors, when they hear about what we're doing, are amazed, and they're like, yes, obviously that need is there. We recognize it from our treatment side. I never heard of anyone doing this in oncology, but thank you. This is making my life so much easier with your clients who come in and aren't just deer in headlights with their head spinning because it's information overload and it's scary and it's stressful on top of life in general, which is not dissimilar. But we find that they're often quite receptive. In addition, in the background, so whether we're directly involved with that patient or not, when we have difficult cases, which I'd argue almost every cancer diagnosis is, because it's got unique patient-specific variables as well as disease-specific variables, and you have to match up those as best as you're able to on behalf of that patient. We have a clinical advisory board made up of people at the top of their game in both surgery and medical oncology and radiation oncology, as well as in different diagnoses. But beyond that, we have with our team an extensive network around the country, not formally affiliated, just collegial. When it comes to treating cancers, many of which are quite unique, it's a small world of experts and people at the top of their experienced and academic and clinical game. So, we're respective of not just asking experts for their free opinions, but oftentimes, if we know of a very exciting or new treatment that's being offered at a specific cancer center or facility or practice, we might reach out to them on behalf of our client and say, I think I have somebody here who might be a good patient for you, not formally, but maybe informally. Could I summarize for you the case and you let me know if that's someone who you would be excited to see, have the time to see, are interested in seeing, or have something additional to offer? And in the midst of that conversation, we often build wonderful relationships with the doctors who are really in this for the right reasons. They care about individuals. They want to help patients. They want to offer the latest and greatest things when they are on the right track to benefiting patients. The landscape to figure out which patients and which doctors are going to be more receptive to our involvement and our working with them is quite varied. You catch anyone on a bad day for a Friday afternoon when they're catching up with the rest of the week's work and they just don't have the time. I mean, many people experience that they waited for 30 minutes or an hour or 2 hours for the doctor to show up for the appointment. And when they do, the doctor still hasn't had a chance to look over the chart and catch up, and they kind of have a limited amount of time. You can just sense that. That is real. And then you may, none of us know what everyone else is bringing to the table, but for many doctors, they've got administrators, they've got colleagues, they've got other patients. They actually do have a life outside of medicine, some of them. And those stressors are handled in lots of different ways. So sometimes, the doctors are like, I don't have time to talk to anyone else. Here, I've got time to talk to you about this one thing, and that's what you're here for. And let me get on to my next patient because I need to be able to say that we reviewed this lab value or something. That's an extreme. But
well, what in that case, what do you've equipped the patient. Let's say I've got prostate cancer. I just had my colonoscopy, by the way, super clean. I mean, I'd never seen that photo before, but I was like, that's interesting. But wow, it was my first in my my mid 40s now. But let's say it went the opposite route. And now I've worked with you. You've equipped me about the next steps. You've equipped me on what I need to look for and ask my next on my next visit. But I walk in there with, you have an expectation of that physician, how that physician is going to handle that appointment. And you understand that, yeah, they're going to be probably time constrained. So you're probably only going to get 2 of the 6 things that I'm outlining, answered today. So, time is valuable. Education and information is even, I would say, even more valuable in some ways. So how do you handle those types of visits? Or is that not even, maybe because I've never had cancer and I hope I don't, but we'll see. Is there time in those visits? How do you handle those visits when they don't get through all 6 of the bullet points and they come back to you and they say, well, she only answered 2 and, I'm kind of disappointed, kind of deflated. What do you say to the patient at that point?
So I have, as I know you do, Michael, a kind of a high bar for what I feel like the customer experience should be, and I don't expect, because I have intimate knowledge, that to provide a 5-star hotel experience to every client is not a feasible option in today's landscape. A lot of hospitals and practices know that, and when it comes to cancer, the patients come to get treatment, and the experience is important. But honestly, a lot the way the business models and the current landscapes, whether it's a for-profit, not-for-profit, academic institution, um, the reimbursement models, the payment models, the quality control metrics, which are a semantic of sorts. Quality means different things to different people and to different institutions and bodies. But I don't blame anybody for not being able to meet a 5-star threshold. Now, I would say I arguably, and hopefully most of the treating physicians do, get to know the individual patient and family support system really well. And I help them develop a subjective barometer, because you need to find people who are good at treatment. You also want to find people who you feel like you can trust and you can communicate with. And and it's gotten to a point where you don't need the summa cum laude, top of the class doctor in every aspect of your care. In fact, sometimes that person's pedigree may dictate their behavior in a way that isn't a great fit. You know, I think doctors who are willing to charitably and empathetically, I mean, they get paid, but they don't get paid to just sit with you for 2 hours and go over things. They get paid a certain amount. It's the same if they meet you with you for 30 minutes, 45 minutes, 60 minutes. I mean, the incremental changes in how much they get paid is minimal. But what I try, if I run into a difficult client, or I mean, a client patient relationship with their treating doctor, we explore how to maintain those relationships as long as they are maintainable or tolerable. And it's really not much different than finding anyone in a setting where, if somebody doesn't instill you with confidence or make you feel like you're being heard or make you feel like you're being cared for in an intimate way, because the doctor patient relationship is an intimate relationship. There's something, we're talking about doing something to your body and allowing someone else to do it to you. So if somebody, for instance, says, look, I met with you 3 weeks ago and I told you what I thought you should do, so what are you here for? And you say, well, I just really want to go over it all again. I had some additional questions. And they say, wait a minute, we went over all those. I like, what's your question about? And then you bring up something. You say, well, I think I'm leaning this way. It's not what you recommended, but it feels like it's a better fit for me. And if the doctor, we've had patients and doctors say, well, if you know what you want to do, then just go and do it. I guess I'm just here for no reason. And some of them will even storm out of the room, like not appreciating being questioned. It's a very old school model when it comes to care and the practice of medicine. The white coat on a pedestal model, arguably should have been shelved a long time ago, because in the modern world, we appreciate honesty and humility. And when you say, look, I don't know the answer to that, but I'm going to do my best to find out the answer for you, that is so much more valuable than a doctor saying, I told you what you need to do, you just need to do it my way or the highway, kind of thing. Some patients, just because they're scared, don't think they have any other options, and they'll just sign up for whatever that was. Other patients will recognize that this is how the behavior was with that doctor and that team before I ever started getting treatment. So if treatment goes great, fine. But what happens when something unexpected occurs? There's a side effect, or I need them after hours or something. This may be a telltale. So I've had some patients early on in our practice come back and say, gosh, it really upset me. This doctor, when I asked them what seems like very reasonable questions, they got very frustrated and upset. And they even like walked out of the clinic, telling me to come back when I was ready to do what they told me to do. And we've discussed with those patients, look, this may be a good thing. You're not committed in this paradigm right now. You can have another doctor. You can drive that discussion. The customer experience and how that mission is, or how that culture is developed at one facility or another, is critical to that experience. And so we try to set the right expectations for patients, and we try to help encourage them to advocate for themselves about what's important to them, and let the doctor know that, look, the most important thing for me is not to suffer, and I don't want side effects from this, or this. So what's my risk of side effects, and what's my potential statistical benefit from this treatment? And let me work with you as my treating doctor to make that decision together, as opposed to just a one-sided relationship. So there's a lot of, I would say, experience-based behaviors that we engage with to help patients. When I came right out of training, I don't think I was as equipped. I know I wasn't as equipped as I am today, after treating thousands of patients over decades, to handle those types of situations in a gentle and not more stress-inducing manner. So there's a lot that goes into what that customer experience looks like, and we really try not to be overly demanding in what you should expect, but we try to maintain at least a par threshold of what is reasonable. And every patient's different. Some patients are like, I'm going to stick with this team no matter what. I believe in them. And that's great. We don't want to compromise that trust or behavior at all. But we do want the patients to have an informed consent aspect to their experience, and to stay within standards. Other patients just want to know that they're being heard, and feel like they're being treated in the way that they would like to be treated, not trying to fit a square block into a circular hole, saying, well, you're just another patient with a stage 1 breast cancer. So this is how we treat that. This is how we treat you because you have your diagnosis. Not, we're going to treat you as the individual with this diagnosis, and let's cater to your whole person in a way that it's just not realistic to expect doctors to be able to do that. We don't get great training in all those aspects. It's not part of the current landscape. And so that does touch on some of the larger problems in healthcare, but we do serve a lot of roles in a supportive manner, much more so than in a critical manner.
Well, our guest today is Dr. Levitt. We have the links to his practice in the show notes below. So please check out those and how to connect with Dr. Levitt to learn more, ask questions, be a resource for you and your practice related to what he is doing in concierge medicine and cancer diagnoses, and being an advocate, an educator. Now we move into the lightning round of questions. You can be fairly brief with your answers on these questions in order to move through them fairly quickly. So the first question for you is trying to choose because they're all so juicy. At what point in the process or the diagnosis do I call you, bring you in? I found you, like, oh, I didn't even know this type of practice or this type of doctor existed out there. It's not that I'm signing you up to be my, my surgeon by any means, but it's like, oh, I just found you. When do I bring you in if I'm a patient with a recent diagnosis?
At any time. Recent diagnosis, past diagnosis, development of new disease, management of side effects, difficulty with insurance navigation. We do a thorough introductory discussion to make sure that there is a role for us to play. We're very honest about what we do and how we do it. And sometimes, everything is right on par and the patient's happy and they were given our name by one of their friends who we helped a whole bunch. And they say, I'm like, got my plan. I love my doctors. I had my treatment. I'm doing great. I'm living my best life. I feel like I'm able to live a healthier, more well life because of my cancer or since my cancer than maybe I was even beforehand. There's not a lot for us to do. If they want us on call and available at any time to answer quick questions, that may play a role, but we're honest that that's not really the bulk of the work that we do and provide. And so we do, if at any time, but really we have a pretty extensive period of time where if a patient's not happy with our services, we refund all of our fees and are not looking to be an additional financial hardship on anybody. In fact, that's been a challenge for me as a physician to dive into the entrepreneurial world and figure out, well, where and how does this business model affect what we are seeking to do? So the answer really, I mean, sometimes it's family members who say, look, we just don't understand what's going on. We're worried about them. We don't know if they're really getting all the options presented to them. And it's stressing all of us out because we care so much about our patient. So sometimes we get engaged by their support system on their behalf. We have some large philanthropic donors who sometimes will ask us to care for one of their partners or colleagues or employees or friends. And we're happy to, and we do some great work there as well. We do have a charitable arm that as we grow, we are committed to providing for patients who may not be able to afford or find us services that reach out beyond just the small scope of patients that ultimately will be able to help amidst the over 2 million new cancer diagnoses in the US that are going to happen this year.
And this is maybe a comment for another podcast where you and I will reconnect on bigger picture topics in healthcare as we've done off script or off the record. And that is, your words have a lot of weight with us. Like I'm not a physician, I'm a patient. And so your words carry 100 pounds. Like they weigh a lot with me. Like you're probably one of the top 5 most influential voices in my life as my physician, behind my wife and kids. So, you call me up and say, we need to talk. It's like, oh no. And, or, like, hey, you're doing great. Like, oh my gosh, I'll be flying high for 30 days until we meet again. And so you've built a business model here. And I think that that's one of the things that is so appealing to me in concierge medicine is that it's a business model based on the weight of your words and understanding your value to your community and to your patients as a physician. And I think that the rub that many outsiders who see concierge medicine and look at it as elitist and have problems with it ethically and whatever, once they understand who you are and who other doctors are and what you're doing, the curtain falls fairly quickly. And it's concierge medicine is not a pricing problem to solve. And you're just like if you are an you are an entrepreneur struggling to build a practice that's, going to serve so many patients. It is your value is going to be attention you're going to manage and have to manage that tension for the rest of your career. And any physician listening is, don't look at your worth as a physician to your community, to your patients as just simply a problem to solve. It is going to be attention that you will manage because of your training. You were taught to be everything to everybody for at all times and to wear it like it's a badge of honor to make no money. Well, I'm here as a patient to tell you that you carry weight with me. Your opinion, your role in my life carries so much weight that I can't afford to have you not be in business tomorrow. And so it's important that you recognize your value and you charge appropriately for that. And, that's a conversation maybe for another day. You're welcome to riff on that as it relates to this next question, and that is, what will the role of your practice play in patients? What will the role of concierge medicine play in the near future? Because, the golden age of where every doctor was happy and there was no physician shortages and you had as much time as you want, you got paid fairly for it. I don't know if those days were ever around, at least they weren't in my lifetime. And, uh, you know, we have to approach change without trying to solve an immediate problem. It's going to be a tension that we're going to manage. It's a complicated healthcare problem. It was created with a lot of healthcare complexity, and it's going to take a lot of small healthcare changes to fix it. So, what role does concierge medicine play? And you can be fairly brief on this, but we've talked about it before. What roles is your practice going to play? Your type of practice and these types of practices going to play in the near future? I'm long-winded. Oh my goodness. I should be a writer.
Gracious, when compassionate, but I think in the short term as well as in the long term, the need is just going to increase, and the benefits are going to further be clarified and delineated. Institutional medicine, whether it's a public, not-for-profit, for-profit, academic, private environment, they are all working within the same political and reimbursement and entrepreneurial landscape. No matter what, if it's a not-for-profit hospital, they need to keep the lights on and pay the bills. They have to have, and many of these not-for-profit hospitals are run by non-healthcare providers, people who are consultants in finance and accounting and things. And then the political side is tethered into that realm as well. Which specialty or field of medicine has the largest political action committee, and does the pharmaceutical companies have a vested interest? Yes. Do the equipment manufacturers have vested interest? Yes. Do the hospitals, the academic and not-for-profit and for-profit? Yes. Fortunately, the very first step occurred not long ago with the Price Transparency Act requiring, it's a strange business, right? It's healthcare. It feels intimate. It feels unique, but it's no different than any other business it has to run. And so there aren't many other businesses where the people paying the bill actually get to determine the price. And that's sort of the larger landscape of the political and legislative and institutional practice of medicine. As many people, and thanks to you and the community of concierge medicine, have realized, there are a lot of concierge or personalized providers available in many other specialties, in primary care and endocrinology and cardiology, even in orthopedics and radiology. What we're doing in cancer is quite unique in that it has not yet been delved into. So what I'd say to at least my concierge colleagues is that I know it's been a hard and arduous path to take the risk of going out and doing something unique that's not traditional in the current medical landscape, to focus and harness their craft in a way that they feel is most conducive to with what they would want as a provider, as a patient. And so as a result, a lot of concierge docs have worked hard and are as busy as can be and don't have a lot of other time to help develop the community at large. But what we do know about those doctors is that they care immensely about their patients because they seek to revolutionize the model of care and to provide a more customer service oriented, comprehensive, and time unlimited experience for their patients. The reality is whether they're a concierge doctor or not, most of the really good primary care doctors are so busy currently, they don't even have time to see anyone else, or to, a lot of their practices are closed, people will find. Some of the concierge docs who have different payment models, direct to patient or membership models, et cetera, their clienteles already recognize the benefit of what it is that they're doing to fill in some of the gaps that exist, that are created, that are being nurtured by the institutional entities. And so what I would say to those people, I imagine there's going to be some of the more prevalent audience members to this podcast, is that once a patient gets a cancer diagnosis, most of the regular doctors or non-cancer focused physicians feel like it's such a different world of medicine. They never see that patient again. They don't know how to affect the experience for their patient going through the cancer journey in the same way that they're affecting all of the other aspects of care that they're providing for their blood pressure, for their diabetes, for their headaches, for their sleep problems. And so all we're doing is trying to extend that service line and that patient tailored experience into the cancer genre or section of medicine. And most of our patients will continue to come from the concierge set of doctors. I think alarming to most of us in medicine is this idea that there's this building or growing distrust or annoyance or dissatisfaction with traditional or Western-based, evidence-based medicine. And as a result, a lot of patients, I was very surprised to find this out as I've developed this new practice, are anti-Western medicine and are seeking alternative therapies for what they arguably could be easily cured from or managed with some simple guidance. And so we're really seeking in the cancer world to bring people who may be working around the fringe of traditional medicine to bring together what is well studied and developed the benefits of, called integrative medicine or complementary medicine, and specifically integrative oncology. I mean, this is bringing the best of all worlds with the things that we know can help from other cultures, other places, along with what we do know, and bring them together in a way that's non-harmful, so that things don't interact, so that the patients don't feel like, well, I can't tell my medical oncologist, my chemotherapy doctor, that I'm doing this, because they're just going to roll their eyes and leave. And so they end up doing something under the radar, which could be harmful to them or could impede the actual effectiveness of a treatment. So that's tragic. And I would say a mission and message that for all of us in the concierge world is that it's so important to get to know your patient. It's so important to treat them the way you'd want to be treated. And we're all trying to make sure that no one is working with only half the deck of information. To take the best care of your patient, you need to have transparency, and everyone needs to be on the same page. And if there's something that any of us doctors need to be informed further about as it relates to something outside of our specialty, we need to know about it. We need to understand it. And in order to do that, we have to be humble and open and recognize that there's more that we don't know than that we do know. And so the Hippocratic Oath is first do no harm. You can only protect your patient if they're comfortable enough to share with you everything that's going on. And sometimes they need a quarterback, or maybe not a quarterback, but they need an offensive coach to help them know how to make sure all my doctors are on the same page. Because ultimately, it's the patient that's the quarterback or the captain of the ship. They just might not know how to run the playbook or sail the ship, and they need help doing that. And that's what ultimately a lot of us treating doctors or concierge doctors seek to provide. So the patient can tell us where do they want to go, and we'll help them figure out how to get there. But we don't expect that every patient did 12 years of training in oncology and in practice for decades and understands the nuances or even can speak the language. And that's where we can find some common ground to bring everyone together, as opposed to the forces that current work, which unintentionally seem to fragment care a lot more so.
Well, and I know that, I mean, I've worked with doctors now over 20 years, and very, very, very few, like I could probably put them on one or two hands, that I felt as though didn't have that empathy and caring and compassionate heart and spirit. And, unfortunately, when we log on to the internet and we start looking at, the opinions in healthcare, we know physicians care, and we know that you're out there. We know that you're working in a constrained system, or, broken system that doesn't appreciate you. So if there is a tension that you're trying to manage, when you think about things like concierge medicine, and your rub is, well, I care, I just do it differently. I would also say, if that's your rub, then ask yourself this question: when was the last time, if you're a busy, hamster wheel type of practice, and you're think that concierge medicine is not something that to consider as an option? It's not the option, it's just an option for doctors. When was the last time you did for one patient what you wish you could do for every patient? Because I think that it's no longer about being the best doctor in the world anymore. It's about being the best doctor for the world and for your patients and for your local community. And Dr. Levitt, you're a true living example of this. You're following your entrepreneurial tendencies, so to speak. So I have two final questions for you. The last book you would recommend, last book you read or you would recommend for physicians listening, or maybe even patients, or people who are listening that are just like, yeah, that's a great book.
Well, I do read a good bit personally. My tastes probably are not as popular in the larger audience. But on our topics, there are some wonderful books out right now on the nature of integrative medicine and integrative oncology. And I would say arguably one of the most digestible, up to date, and evidence based would be one called let me make sure I'm getting the title correct here. Yes, like Anti-Cancer Living by Dr. Lorenzo Cohen. Really culmination of almost a lifelong set of work that Dr. Cohen's done. He is the director of integrative medicine and wellness at MD Anderson in Houston. All the patients who go to MD Anderson don't necessarily get referred to him. I've followed his writings and publications and videos and research for many years.
Well, we'll put that book into the book list as well. Our final question for Dr. Levitt is a challenge between the two. But I think we'll go with this one. Dr. Levitt, as a physician, what do you want to be known for?
As a physician, what do I want to be known for?
Or you could say as a person, what
Right.
do you want to be known for?
Family is so critical and important to me. I want to be known as a great dad, a loving husband, a great role model. Um, in as that overlaps into medicine, I I I see myself and would love to be known for someone who was passionate about doing the right and honest thing as for each individual as they could, and someone who was, while strongly opinionated, quite uh, diligent in those passions. And so I take the charge of caring for an individual very seriously.
This
And
is a reminder.
and whether it was within one of my former practices or departments that I'd run, or in this role, um, I'd like for people to be able to say that, he was doing the right thing as best as he was able to for each individual. He was a great listener. He was able to put himself in my shoes and try to view through my lens what it was that I was going through and what was important to me, on the journey that I had to go through with whatever diagnosis it was.
Well, thank you for your time today. I know we could talk for hours and forever about various different things, and I have multitudes of questions that I didn't even get to that we'll maybe get to next time. So, Dr. Levitt, thank you so much for being our guest today. My final word, or for my final item for you, is how do you want physicians to learn more about you? Besides just a website, what's their first next step after they're like, I have patients who would love to connect with an advisor, an advocate in their cancer diagnosis. They're in different states. Thank you for providing this service. How do I get my patients connected with you? What next steps can doctors take?
We would love for doctors to reach out at any time to learn more about me, my team, our experience. We are growing with the concierge medicine population and community, and we're hopefully right at the beginning of what ultimately I'd like to see as a patient-driven revolution in the medical experience. So anytime, email, text, call. I'll make time, or one of my partners will, to reach out to you and explain in great detail what and how we do what we're doing. We're open to suggestions. We're open to improvements. We are very well equipped technologically to be dynamic as the landscape changes. And so anyone who has any interest on behalf of one of their patients about how we might be able to help, we'd explore that happily. And we look forward to building continued relationships with any and all interested physicians. And we actually see ourselves as a place that could be a savior for many doctors. I think technology and concierge type of approaches for medicine are going to be the potential only saving graces for where the trajectory currently is. And we're seeking to harness all of that so that we can maintain high quality and improved quality of care across the board for patients dealing with cancer.
Well, thank you. And we'll put how to connect with Dr. Levitt in the show notes below, as well as his website, telephone numbers, email, website, all that information, all that juicy, good information will be available to you just below or above. So, Dr. Levitt, thank you so much. As a dad, we'll get into this maybe the next interview, but I'm curious. We have dinner, probably 3 or 4 times a week with our whole family, all 3 kids and my wife, around the kitchen table. And, I'm always curious, being that you have this given specialty and this knowledge and, intimate knowledge about cancer and prevention and different things. That'll be a podcast for another day. Is, what conversations are you having to help your kids live a healthier and more, preventative lifestyle at such a young age? Because I mean, my 10-year-old she's so moldable, right? And then my 16 and 14, or my 17 and 14 are just like not moldable much anymore, So we'll discuss that on another day. But thank you so much for being a dad, for being a family man, but for all the work you do with your peers, both in and out of concierge medicine, but also for the patients and your customers that you work so hard and lose sleep over. Thank you. You're truly living up to the thing we say around here, which is it's no longer about being the best doctor in the world anymore. It is about being the best doctor for the world and for your patients and for your local community. Thank you, Dr. Levitt, for being our guest today.
Thank you very much. Really appreciate it.